Welcome, class. As we move to Chapter 11, we're going to focus on data privacy, confidentiality, and security. In order to be able to do that, I want to make sure that you have a base level and solid understanding of the distinction and differentiation between those three items. Looking at a level of privacy, we think about this as an individual's right to control access to their own personal information, which would include that health data. And so the question here is, who has the right to access the information, which ultimately ensures patient autonomy over their personal data. And so therefore, a doctor, as an example, is going to ask for consent before sharing your medical records with a specialist. And/or you, as the patient, decides which family members can know about their diagnosis or who potentially can talk with clinicians or healthcare professionals. As we look at confidentiality, thinking about the obligation of healthcare providers to protect the patient information from an unauthorized disclosure. And so how is the information shared and with whom to ultimately ensure that only those authorized individuals access patient information as needed for care? So for example, in this instance, a receptionist ensuring that patient names are not overheard in the waiting room. Maybe while they're talking with another healthcare professional, or while they're on the phone, or the like. Or a nurse discussing a patient's condition only with the assigned doctor and not in the public area. Lastly, security. Now, security refers to the measures and the systems in place to protect data from unauthorized access, breaches, or threats. So how is the information protected from external and internal threats? So implementing physical, technical, and administrative safeguards to protect data integrity and access. And so, for example, using encryption to protect EHRs during transmission. And/or implementing secure login systems with multi-factor authentication for accessing patient databases. HIPAA, or the Health Insurance Portability and Accountability Act of '96, ensures health insurance portability and so establishes standards for electronic claims, protects against fraud and abuse, and to certain extents assures the privacy and security of protected health information for patients. Looking again at that privacy role, assuring individuals' health information is properly protected while at the same time allowing for a level of quality of care. The security role, understanding that there are certain administrative, technical, and/or physical security procedures or protocols or internal controls that cover entities to assure for that confidentiality, integrity, and availability of electronic PHI. We have a couple of other items here. The High-Tech HIPAA Omnibus Privacy Act, looking at promoting and the adoption and meaningful use of health information technology, and also the breach notification rule, creating a process for entities and business associates, or BAs, to actually investigate and evaluate if a breach occurred for an unauthorized use or disclosure of PHI. And then certainly if that's the case, there are certain mechanisms that will then kick into gear for investigative and other punitive consequences. When we think about the privacy role, we think about uses and disclosures of PHI. And so we think about what is the minimum necessary, what needs to be seen. We also, within this realm, look at notice of privacy practices, which you will see those throughout clinic environments, hospitals, and other healthcare organizations. When it comes to patient rights, again, determining a certain level for them to request privacy protections in terms of who has access to certain items, who may have communication with the clinical staff, receiving accounting of disclosures, and also having the access for their own personal health information. We know that organizations must implement policies and procedures to address standards and a process to ensure that they are being followed. And to some degree, a process or procedure or internal control to ensure that they are being monitored as well. When we look at the security role, we look at physical safeguards. So who has access to certain pieces of equipment or certain areas where data is available. Technical safeguards. Are there passwords in order to be able to log into systems? Is it a dual level approach, such as when you have to log in through Dory and you have certain second level authentication protocols? And then again, we have the breach notification rule, looking to ensure that there is no unauthorized use or disclosure of PHI at any time, and if there is, may be considered a breach. And so, again, in that instance, the breach notification rule would require that those entities that are covered and or business associates to investigate and evaluate if that breach occurred using specific guidelines and protocols. When we look at the high-tech HIPAA Omnibus Privacy Act, this act ultimately makes business associates liable for compliance and to some extent strengthens privacy protections for genetic information because of the nature of that end data. Also helps to allow that patients have an increase in restriction rights and authorization of future research studies with appropriate description for how PHI will be used. Continuing with HIPAA enforcement, certainly there is a level of compliance and there is an investigative body and an investigation process, penalties for violations, and also procedures for hearings. At which point, determined or based upon those hearings and or those penalties, an organization, business associate may be placed with corrective action inside a corrective action plan and or may be faced with civil monetary penalties, specifically in reasonable cause or willful neglect instances. Use and disclosure with patient authorization. So a valid authorization for disclosure of your personal and private information is required for the following. Disclosure of PHI not permitted to be released without this prior authorization. psychotherapy notes, marketing and or the sale of PHI. For the purposes of treatment, payment, or healthcare operations, certainly information has the opportunity to be released. There's an accounting of disclosures within that process. Certainly, de-identification is taking place with expert determination methods to remove certain personal attributes so that it is not personally identifiable. And then the introduction of re-identification. Looking at patient identity management for use in disclosures of PHI, the verification of requester identity must be completed prior to disclosing any patient information, regardless of the level of format. And best practice recommends that multiple elements are checked with the patient or patient representation for identity verification. Next, we move to confidentiality of alcohol and drug abuse patient records. These follow a different guideline. These must follow the privacy rule. However, as I just mentioned, they also have added safeguards due to the sensitive nature of the patient's care. And so in this instance, authorization requires specific components to be valid, only allows specific exceptions to the authorization of patient consent, and there is a notice of confidentiality of alcohol and drug abuse patient record. In these instances, and for providers, compliance with both federal and state privacy and security regulations is required. Understanding the HIPAA security role ultimately requires the organizations implement a variety, not just one, but a variety of physical, technical, and administrative safeguards to protect the patient data. That requires time, that requires resources, and oftentimes requires monitoring. Oftentimes will include some level of privacy and security compliance programs, and certainly must have in place policies and procedures so that all individuals are aware of those policies, procedures, and practices that are in place, and so that they can follow them. When we move to risk, number one, we have to be able to analyze the risk that is in place or the risk that is there. And then in terms of risk management, determining how we will manage that risk. And so, for instance, will we put security measures to reduce or potentially eliminate some of those risks? In some instances, we will seek to mitigate the risk, which means that we will attempt to the best possible manner to reduce that risk. In other instances, we may accept the risk. In many programs, there are such items as security audits and audit logs and login monitoring to determine, does X, Y, or Z have appropriate access levels? Should they be attempting to log into a system? If they gained access, do they have the appropriate security controls and profiles assigned to them? Part of this also includes contingency planning or disaster planning. This helps an organization for an event that may happen which could impact the ability to access patient information. could be the integrity of the information or the confidentiality of information. All organizations need to have a level of a data backup plan. So, how do you create and store exact copies of electronic protected health information? How often? Where are they stored? Who has access to that? And so that defines how the system is being backed up. The method of backing up, as I mentioned, the location, the frequency, and also the testing of the backup to ensure that all of the systems are doing exactly what they should be doing. We also have disaster recovery plans, where we look for the specific definition of the process for the recovery of data, the actual process by which we do that, God forbid, in the event of a disaster. We also have an emergency mode operation plan where we have process and procedures to support the continuation of critical business and patient care operations while protecting the security of EPHI, again, in the event of a disaster. We have emergency access and also software criticality analysis in order to understand how crucial each system is, how crucial the software is, the data is, to the overall day-to-day healthcare operations and patient care. Some of these we've talked about already, or you may be familiar with, but data security methods. So for instance, user authentication. How do you log into a system? How often is the password changed? Is there a dual system in place where not only do you have to type in a password, but now you also have to recognize via your phone that you are attempting to log into the system? Many opportunities for malicious attacks that are out there in cyber world of today. A number of malware opportunities, phishing, viruses that are sent, along with a number of other items that continually pop up seemingly day to day. All of this being compacted as we continue to focus with mobile health technology, where organizations are allowing individuals to bring your own devices to work, personal phones that are connected to networks, tablets, laptops, potentially laptops that are going home with employees, and also USB or jump drives. And again, continuing on the list, external hard drives, and even in today's world, wearable technology, and how those will continue to impact safeguarding data for organizations. All of this certainly will be part of HIPAA privacy and security rules that are going to require formal education and training for our workforce. That includes new employees, but it also engages and includes ongoing training for current employees, retraining for individuals that may not be doing exactly what is expected of them. Also understanding various levels of training, again, based on, are you a new employee? Are you an experienced employee? What best practices are, and updated training as those best practices may change, and also ensuring that we continue to update documentation. Many things for us to think about as it relates to confidentiality, data, privacy, and the like. I look forward to meeting with you again soon as we cover our next chapter.